So I have the great honor of welcoming back Carolyn Sakai. She is for those of you that don't know her yet, she is a fabulous person and really committed to helping people in our community. She has 36 years of clinical practice, and she served as chief psychologist at Kaiser here in behavioral health sciences before she retired. So she had 31 years over at Kaiser. She currently is in private practice and is an authorized trainer of thought field therapy. So Carolyn has amazing stories. She's led volunteer clinical teams working with TFT with Katarina, the Hurricane Katarina first responders and survivors, and also genocide survivors in Rwanda. The TFT Center is run by her, and she is an authorized training of the Callahan Techniques Thought Field Therapy. And she has been doing thought field therapy, or TFT, since 1998. So I could also tell you she's been a practicing clinical therapist since 1966. And has done a bunch of, she got her master's degree in social work and psychology and a PhD in clinical psychology from the Pacific Graduate School in Palo Alto, my hometown. And her emphasis is on empowering clients to enhance their functioning and optimizing their health through the most efficient modalities and utilizing methods which clients can practice themselves whenever feasible. So without further ado, Carolyn, welcome to Kokua Mau. Welcome back to Kokua Mau. We're so glad you could join us, and take it away.
Thank you so much for having me. This is such an honor, and I have looked forward. I really enjoyed 2 years ago talking to this group, August's group, and I have been honored to join you again. I'd like to share with you today. I see that some people are new, so we'll do a little bit of introduction as we're going through this. And we're going to look at especially focusing on how this can help us with all the anxiety and stress and depression and all the trauma that goes with dealing with the pandemic. Thought field therapy is actually a self-treatment that uses the meridians that are used in acupuncture and acupressure. It was developed by clinical psychologist Roger Callahan, who died a few years ago, but he discovered that by tapping on these meridian points, and you can also do it by tapping, massaging, or you can even do it mentally, and that we have many people doing it mentally. We have entertainers with panic attacks, for example, who may be doing the treatment on stage in front of hundreds of people, but just doing it mentally. Roger wrote a book, Tapping the Healer Within, in 2001. There are a number of research studies, including we were able to do some research when we were in Rwanda. They actually wanted to give back when they saw how it was helping their population. And when they said, oh, you guys are really lucky in Hawaii, in the United States, that you have this treatment that everybody must be healthy and happy. And we said, no, you're ahead of us because you take it into your schools, into the military, you take it all over the place. And we actually are slow in doing that because we need randomized control studies. So that's when they were able to volunteer to help us to do these randomized control studies, which are available on my website, www.tftcenter.com, which will show in the end of the presentation, the website. Dr. David Feinstein, who was a clinical research professor at Johns Hopkins, he's not there now, but he did a meta-analysis of 51 energy tapping studies. 18 of them were randomized control studies, and he included our randomized control studies, and he also published it in the Review of Journal Psychology. And after this was published in 2012, after that, thought field therapy became more accepted as an evidence based therapy. This is the book that I have written, over, Overcoming Adversity: How Energy Tapping Transforms Your Life's Worst Experiences. It's a primer for post traumatic growth. And it has different case examples, also has in the we have case examples and what the treatments are for like depression, anxiety, trauma, chronic pain, a whole host of things. And we also have some of the stories from Rwanda, and the appendix says how to do the treatment, which you can also see on my website. First, I went to learn thought field therapy from Roger Callahan because I wanted to develop our behavioral medicine program. When I studied with Roger Callahan, it was because I wanted to find something that we could use in behavioral medicine, which I wanted to start here at Kaiser Hawaii. And we were putting the social workers, psychologists, mental health practitioners right into the healthcare teams. And we needed rapid self-treatment tools. So this is where I went to study with Roger and learn how to do the thought field therapy, which this is a process summary of the things that we were working with, like anger. We had 162 people, the rating at 0 to 10. We also did paper and pencil tests and other heart rate variability, but I'll show you their subjective units of distress, which we use as a process measure. The range was 2.5 to 10. We're using the SUD-WOPI scale: 0, none at all, 10 is the highest it goes for them. So the range was 2.5 to 10. The mean was 8.18. And this is within one session. The range dropped to 0 to 9, and the mean dropped to 1.02. For anxiety, 216 people, 7.54. The mean before treatment, 0.86. This is in the same session. And for chronic pain, 234 people, 6.82 down to 2.24. Depression, 106 people, 7.35 down to 1.59. We can also work on maladaptive food cravings. So we're using it in our diabetic clinics and with the heart rate, with blood pressure, and also with blood sugar, cravings for sugar. Post-traumatic stress disorder, 142 people, 8.71 down to 1.22. And then work stress, which I'll show you in our heart rate variability on it, 7.66 down to 1.45. So this is a heart rate variability of a person who has stress. He is in his 60s. He had a SUD of 10 that went to 0 on his heart rate variability, which is we're using the 5-minute HRV. The 24-hour HRV is a Holter monitor. But what we're doing is 5-minute HRV with 6 ECG leads. So we're looking at 5 minutes before treatment, do the treatment, then 5 minutes, then after the treatment. Before treatment, his total power was 100. After treatment, 1,200, which is good. He had, this is kind of a step pattern in the very low frequency, high frequency hertz. This is a better pattern that we're looking for. This is autonomic balance. In this yellow square would be sympathetic, parasympathetic balance. Fight or flight versus relaxation response would be here. He's way out here, but after treatment, right into autonomic balance. And this is the actual tachogram before treatment, tight constriction of the heart rate variability, which opened up after treatment. This is in one session. We had worked with orphans in Rwanda with their trauma and depression, anger, rage, anxiety, fear. And they were so debilitated that we saw them 12 years after the genocide, but they were unable to study and learn because of the flashbacks and the nightmares that were constant. So even after 12 years, they still hadn't really learned adequately to read, write, or do their math. So they were still in the transitional school. After they were treated for their trauma, depression, anxiety, anger, this is the results were that within 1 year after they were treated, they were able to concentrate and learn well enough to pass the competitive Rwandan exams and get into the regular public schools. That study that we did pre, post, 3 months, 6 months, 1 year follow up. That's this, it's highlighted, but it doesn't show very well. It's in pink here. This outlier. This is a meta analysis that's showing the interventions, including cognitive behavioral, these are all cognitive behavioral therapy, EMDR, a number of different treatment programs. And the meta-analysis is showing that all the treatments in here are not really very effective, doesn't meet the level of effectiveness. The one outlier way out here is the thought field therapy study that we were doing. And this was embraced by we were sponsored in a lot of the trainings and treatment programs by the Catholic diocese. They're majority are Catholic in Rwanda. There were also a large number of Christians, but this is their office for the Byumba, and you can see that they have family service, and they have for the infants and young people. They have all kinds of different. These are their different departments, and you notice Deborah New from Hawaii is trying to reach is almost tall enough to reach. There is a department for thought field therapy, and they're using it across the board for their youth and for families and for different situations. By the way, where we were in Byumba, where this is we were um, the places that we were training people has become the national COVID treatment center for all of Rwanda. And they were very good about staying at home, using their masks, not keeping to their homes except for when they had to go out. So their number of cases were extremely low. So they were um, medical staff in a very small hospital that they have there were just like overwhelmed with fear and fright when they look at they're going to be the national COVID treatment center for Rwanda, and people from all over Rwanda being sent there. So they were freaking out. So Father Augustine, who's some of you have met, that was here for trainings, Father Augustine said, we're going to be working with the nurses and medical staff with the thought field therapy to help with their fear so that they can stay centered and grounded, and they can then continue to be able to carry on their work, which has been working out very well. And they're using TFT in their COVID treatment center there. We were working with widows with their grief, and the widows, when we saw them 12 to 15 years after the genocide, had been having difficulty functioning. The women at that time were kind of more the second class citizen. They're lower on the scale to look at services and things. They're not in a good position. So the widows were really struggling, and they were trying to get them help with the NGOs, trying to give them help them with farming and things. But because of the depression and the PTSD, flashbacks and the nightmares, they could not function. So those projects were not being very successful because of the fear and depression and nightmares and flashbacks. So they, after treatment, and they learned how to get the nightmares and depression and the anxiety down, they were able to become more functional. They were then be able to focus, and they have gone from poverty to becoming very successful agricultural co-op managers. They're now producing enough food, not only to feed their own families and their neighbors and the communities, they now have a surplus for marketing. So they're exporting, starting to export some of their products. And the thing, when we were looking at the fields and surveying what they were had accomplished, they very proudly laughed when we said, "Oh my goodness, are those? They look like they're men in the fields, hauling the potatoes. You know, they're harvesting and they're carrying the potatoes." And they laughed. They said, "Yes, we hired them." So that was quite a turnaround, because it's a matter of economics. When they became successful, they were able to have more status in the community, and they're you'll see them in the next slide, smiling and laughing. They also became tailors, business owners, and successful entrepreneurs. So they have formed a group, a widows TFT group, and they are actually meet regularly. They share TFT, and they're now starting to help to mentor the single mothers who now at the bottom of the scale in the country. So one of the things when we're looking at the response to the pandemic is that we need to get out of being overwhelmed. So we're going to work first all together on getting centered and grounded, because we need to be able to stay centered and grounded and focused. We need to be able to overcome the overwhelm and adversity. We need to be able to integrate mind, body, and spirit. And the more we're calmer, and that's why we want to work on the anxiety, ameliorate the depression, ameliorate the fears, and get past the anger and the trauma. Uh, the more we can get to be calmer, the more we can enhance our own coping mechanisms and the resiliency. And we see that really makes a difference when we're looking at the resistance and the um, body's own ability to combat any type of illness. I believe that wholeheartedly, and have seen that myself, because I have been able to go to the third world countries like Rwanda, because I have been able to use the thought field therapy to really enhance my immune function, which has been, I've had struggle with lupus throughout my life. And so now at almost 79, I am actually healthier now than I was in my 20s, 30s, 40s, and 50s before I knew TFT. So this is something that can really enhance our immune function. So it's really, really important for all of us. So first off is getting centered and grounded. So if you can make a little fist, it's like, hey, this is for our par. And you notice that where the line crosses your palm on the blade of your hand, there is a little bump here where the line crosses your palm. If you can tap or massage there, you can have your hand open. This is your small intestine meridian, the Ki or Chi meridian. It gets you centered, it gets you grounded, helps to lessen self-doubt and negativity. It is actually a psychological reversal. So, and it's a polarity reversal. The positive healing polarity goes to negative, like in situations like cancer, other illnesses. And this can help us reverse that negative polarity and get it to positive. I had a person who had was referred because there was a abscess from they were trying to do some dental work that did not heal, and it hadn't been healing for, this was over 3 months, and it wasn't still healing, so they couldn't continue the work. And they had tried all the antibiotics, nothing was seeming to work. So they said they don't know, the person was getting very depressed because it's hard to keep chewing for so many months out of one side of the mouth. You can't really eat very many things. So we were actually looking at how to help with that. So we were doing the getting centered and grounded. We're doing other things too. But while she was doing her treatment, she said, something's happening in her mouth. And she opened her mouth and I see like there's peroxide or something, there's all this white foam that wasn't there before. So I said, oh my goodness, what's happening to your mouth? So she went and looked in the bathroom. She said, oh my goodness, there's all this white foam. I said, must be your body's own healing getting kicked in or something. And sure enough, she kept on doing the reversals and other things, and her infection that didn't heal was able to heal. She had been on all these antibiotics, but there was something about her own body's immunity that somehow wasn't kicking in. So, this is something we can do to get centered and grounded, to reduce our self doubt, and to stay more focused. We're also going to be looking at how to do some things for stress, frustration, anxiety, and grief. We're going to, I actually put together, this is, let me show you the next slide. And then with the secondary trauma, passion fatigue, you can see this is the trauma treatment here: eyebrow, under eye, underarm, under collarbone. For anger, tiny finger on the collarbone. For rage, outside edge of the eye under the collarbone. For guilt, index finger under the collarbone. And for sadness, the gamut spot under the collarbone. So these are all different components that you can actually put together. With the thought field therapy, there are also ways, these are like algorithms. You would call these the standard algorithms that have worked for maybe about 75 to 80% of the people. There are also individualized treatments that are obtained either by an energy testing procedure or another procedure where we can actually determine which meridians are involved. So let me get back to the previous one, which is easier to read and has fewer of them. So we're going to look at the tapping points to get centered and grounded. We're going to do the karate point on the side of the hand. So maybe we can all do that together. And that is, as you see the meridians across on the other side, that is the small intestine meridian. And that's to get us centered and grounded. To work with frustration and a little anger would be the tiny finger, and that's the last digit of your tiny finger on the thumb side, on the side of the nail bed. So if we can tap there, you can either tap or press and release or massage all of the points. You can also do it mentally. I'll show you how after we get this, we go through this. And you can do it either side or both. So you're on that tiny finger, and the tiny finger is your heart meridian. And also part of the anger frustration is the gallbladder, which is from the corner of your eye. If you can move horizontally to where the eye orbit is, if you can massage here, usually this one is so close to the eye that we prefer not to have people tap it, especially if they're angry and they're upset. You don't want to possibly hit your eye. So this one would be good to massage the outside edge of your eye, and that is your gallbladder. I'll actually show you points. This is since COVID. There are points off the face that we can use that I figured out from the meridian chart. So we'll get to that later. Okay, so this is for anger. Now this is the actual trauma treatment. This is for anger rage, the tiny finger outside edge of the eye. Now this is for the trauma, these next four. The beginning of your eyebrow, this is on the nose side. You can massage or tap here. That beginning of your eyebrow, the first part of the trauma treatment, is your bladder meridian. Good. And then the next point is under your eye for your stomach meridian. You can either tap or massage or press and release. And then we have about 1 hand width down under your arm on the side of your body is your spleen meridian. For women, it's about in line with where the bra strap is. And for men, it's about in line with where the nipple is. And you can do either side or both. So that's for your spleen meridian. Under the arm is your spleen meridian. And then the last point for the trauma is between your two collarbone notches. If you go down about an inch and over about an inch, then you're under the collarbone. So if you can tap or massage under your collarbone, this is your kidney meridian. Okay, and then for the sadness, fatigue, and also for pain is the thyroid meridian. It's on the back of your hand from between the last two fingers past the knuckle. It's in this little valley between the fourth and fifth metacarpal. So between the fourth and fifth finger bones here, you can put maybe 3 fingers here, and you can either tap or press and release or massage it, whichever feels easier to do or feels better for you. Because this one, which is for the thyroid meridian, it's a gamut spot, we call it, because it's where like triple warmer where 3 meridians are coming together. We're going to massage or activate that for about a half a minute to a minute. We do this one much longer. There's sometimes you would see these algorithms written out with like 5 to 10 times, 10 to 15 times, but never count. It's by feel. So if you're going along and you say, oh, something's happening there, just stay there longer until it stabilizes. But this one for the depression, fatigue, sadness, grief, loss. So we have that a lot when we're dealing with the losses and grief. We want to do it longer. It takes a longer time for this one to go through. So it's about half a minute to a minute, activating that. And then the last one is between your two collarbone notches, down an inch, over an inch, under your collarbone. And that's for your kidney meridian. And to do a complete treatment, This one has more because this one has added the rage treatment, which we had the anger and the rage and we combined it, but we didn't have the guilt treatment. If there is survivor guilt, you can do the last digit of your index finger on the thumb side, and you can tap there and then under your collarbone. So this is our major treatment protocol. And after we do the major treatment call, we then check to see if there's any change. So that's when we do a subjective units of distress, SUD. And if we find that it has gone down, if it's a high SUD, if it's gone down 2 or more, then we would go on to look at any history related to that because we want to get as complete a treatment as possible. If after going through this, we're not really seeing any appreciable change or no change, we might try getting them centered and grounded during the karate point to see what would happen if we do the karate point. We actually had put it in automatically on the other protocol because in many situations we find that that was needed. But if it wasn't done, then we can put it in here and then redo this treatment. That's why we have it in the previous slide. We saw that we had already put it in to get the person centered and grounded first. If we see some progress with this, then we're wanting to get as complete a treatment as we can. So then we would go to the 9 gamut series. The 9 gamut series is a way that by activating different parts of the brain, you know, when you think about things that have happened and you look in different directions depending on where the memories are stored. So we're actually doing some eye movements and some activities to stimulate the memories, somatic memories, verbal memories, conceptual memories that are stored in different parts of the brain. We grab those while we're anchored on the gamut spot. And then after we grab those, then we will repeat the meridian treatment. So let's actually go through that. So if we're grabbing the memories, we'd be on this gamut spot, activating that, and we're going to keep our head relatively still. We're just moving our eyes. So close your eyes, open your eyes, keeping your head still. Just let your eyes look down on the floor on one side of you. Then let your eyes go to normal eye level. Then let your eyes look down on the floor on the other side of you. Then let your eyes go to normal eye level. And this next part, if you have retinal detachment or if the person you're um, is doing the thought field therapy has retinal detachment, we will want to modify or skip this part because it's going to involve having the eye go around in a circle. So if you have retinal detachment, you might skip this part or modify it for you. If not, if you can do this. And if anything's uncomfortable, stop and don't do it. And we can actually address how we do it differently. So while you're on the gamut spot, you're anchoring here and you're relatively keeping your head relatively still. So now what we're going to do is let your eyes go round in a circle in one direction, then round in a circle in the opposite direction. Good. Then we're going to activate the right side of the brain, the more creative spatial relationship side, by humming different notes. You can do it either out loud or silently. That activates the more creative spatial relationship side of the brain. And then we're going to activate the more verbal analytical side, the left side, by counting either out loud or silently. 1, 2, 3, 4, 5. Then activate the right side again by humming. And then after we activate those, then we're going to go now to repeating the meridians. So we did the meridians, we're now activating the memories, and now we're going to repeat the meridians. So now we do the eyebrow. We'll do it on this one now. Eyebrow, then under eye, then underarm, then under collarbone for the trauma, tiny finger for the anger, the under the collarbone, then outside edge of the eye for the gallbladder, and then under the collarbone, that's for the more intense anger. And then if we have guilt, survivor guilt, index finger, and then under the collarbone. And then for the sadness and fatigue and pain, we're on the gamut spot for about a half a minute to a minute. Very good. Then under your collarbone. So before we go any further, any questions on that? Can we take questions if someone has any questions on that?
Kate is asking whether you can over tap.
Actually, no, you just going to do gentle pressure. Don't tap hard. You don't want to have black and blues, but like you can do it by tapping or pressing and release or massaging, or you can also do it mentally. You can't over tap because you find that something's happening. You may want to continue longer till it stabilizes, but you could do it gently. You can just even leave your hand in that position.
So you can do it multiple times a day.
Yes, you can do it multiple times a day. In fact, if you're trying to retrain the neural pathways in the brain, that's a good thing to do because you want to change the habits. You want to change what has been and kind of like an automatic pilot way. We have, for example, I was working with a cocaine addict and he said, well, how often do I need to do this? And I said, well, how often do you have the craving? He said, lady, I get it from the time I get up to the time I go to bed. So I said, okay, then you do it from the time you get up to the time you go to bed. And he actually was motivated, so he did do it. We had a fellow who had, he was asthmatic, severe asthmatic. He was having panic attacks. Panic attacks are really bad. By the time he was in his um, maybe I would say early, late adult life, he was having 10 to 12 panic attacks a day. And so because every time he has a panic attack, he has a asthma attack. So he was using the inhalers. And the doctor finally realized why he was coming in to get so many inhalers. He said, what are you doing with all the inhalers? He said, I'm using them. He said, well, you can't use it. You can't use that many. So he referred him. He then learned to do the thought field therapy, was tapping 10 to 12 times a day, and he wasn't having panic attacks. And so well, I was following up with him, and it's a habit. He has been having panic attacks since he was a kid, and he's now in his early, late adult life. So I thought it's going to take, at least maybe 8 weeks or something, and then we can look at him tapering it off. But he was doing it 10 to 12 times a day. And because he wasn't having panic attacks, he was now able to function. So he was making things, and he was making something for his grandson. And he was so excited about doing it and wanted to finish it before the kid came over. So he was working on it and he forgot the time. And then he realized it was 2 o'clock in the afternoon and he hadn't done the tapping at all. So he did the tapping and he called me up and he said, Caroline, it's 2 o'clock in the afternoon. And I had no idea why. I said, what's wrong with 2 o'clock in the afternoon? He said, I didn't do any tapping. And I said, did you have any panic attack? He said, no, I didn't even think about it because I was busy making this bird feeder thing for my grandson. I said, well, I was going to tell you on your next session that, we can start tapering it down because you have not had panic attacks since you started doing this 10 to 12 times a day. And he said, oh, I thought I wasn't having the panic attack because I was doing it 10 to 12 times a day. And I said, now in the beginning, that was true. But now that you've retrained these neural pathways in the brain, you're not firing like that anymore. So you can taper it down and you can actually just do it now as needed. So, that can do for retraining the brain. There are some things that we don't need to do it that often. Some of these genocide survivors in Rwanda, we actually had them do it. They did not have prior traumas, even though horrific as the genocide was, and the flashbacks and nightmares remitted. Many people with complex layers and layers of traumas, then we go through and we keep repeating through the more, because untreated things come up and that weren't in our thought field. And then when we put them in our thought field and we treat them, then we're getting it down to different layer. Down at the bottom here where we see reversals are where we may have to go to even deeper layers to get more of the depth and scope of the treatment. So we may be repeating it more than the a few times.
Another
That's a good.
question, Carolyn, is
Yes.
is can you is this something you can do for others, or is it something you have to do for yourself only, to yourself only?
Oh, it's something that you can also do for others. Like we have um, mothers and parents and caretakers doing it for their infants or toddlers, and the people doing it for their pets, veterinarians doing it for pets that are like a dog that's hit by a car and they're snapping. They can't give them anesthetic because the dog is snapping, and they can't even do the surgery. So the veterinarian has everything ready, starts to do the trauma anger treatment on herself with the dog watching intently. The mirror neurons activate, and as soon as she sees the vagus nerve and the body relax, she then administers the anesthetic and can do the treatment. So, yes, you can do it. We have Alzheimer's patients who the caretaker is doing it, and sometimes you can do it for the person, like with the Alzheimer's patient, they cannot give you informed consent, but you can look at the nice thing is if you're doing bilateral massage and you're doing bilateral, I'll show you points off the face too in the next slide. But if you're doing bilateral massage, it's very relaxing and comforting, especially when you're hitting the right meridian points. It can just relax the person. So we had a Alzheimer's patient who was in a care home that was closing, and she's also got OCD. And so, when they cleaned the room and they put something back, they think it's exactly the way that she had it, but it's a little off. And she has conniptions and she's freaking out. And they have to take maybe 2 or 3 people to calm her down for hours. So they're looking at the care home is closing. They're going to have a hard time moving her into the next care home. Fortunately, one of the caregivers in that home was also going to be hired by the place she was going to move to. So she was trained with all the TFT things. Anger, frustration, fear, anxiety, trauma, obsessive protocol was on the end of every one of those. So she worked with her throughout the time that they had to start packing things, and that she's having conniptions. This one person one-on-one with her was able to do the treatment, bilateral massage or mirror image, doing it on herself when she couldn't get to do it on the patient. But the patient actually was very good with bilateral massage, found it relaxing, so she could oftentimes do the bilateral massage. But they were able to successfully move that patient. So you can do it either by doing it on the person, or you can do it by mirror image if they're watching you. Sometimes you have kids and you have to do things to get their attention for them to focus on what you're doing, but the mirror neurons will fire. And so you can actually treat them when they're watching you.
Wow. Very cool. Couple more questions. Does this work for kids with ADHD or autism?
Yes, in fact, in my book, there is one about an autism spectrum kid, and it works very well with ADHD. There is collarbone breathing and some other things that we can do that were originally developed for neurological integration that can be very helpful. There is a kindergarten class, kindergarten teacher out on the Waianae Coast where there's a lot of drug babies. And she has been using the thought field therapy with her kindergarten class because she has a lot of ADD, ADHD. And she does that. Um, she has them get centered and focused, and she does the collarbone breathing. She was amazed. She said they take turns, they sit in their seat, and she said whenever she starts the day with it, whenever any kid gets out of line, before she used to go there, get them calmed down. While she's doing that, another kid pops up, and then another kid pops up. And she said all day long, she's putting out fires. What she does now is just start the day with it. And as soon as, say, Hope acts up, then she goes and has the whole class do it. So maybe James was about to pop up, but then got calmed down too, and so did Marcus. So then everybody gets calmed down at the same time. She can teach for another 45 minutes or so before somebody else pops up and is getting antsy. And then she does it again. So I said, oh, you do it many times during the day because for ADHD, it's recommended to do it, multiple times, like maybe 12 times a day. And she said on bad days, she does do it 12 times a day or more. On good days, maybe she only does it 7 times. But that she has been able to maintain order in the classroom. She used to refer maybe 9, 10 kids every year for ADHD medication. Once she started doing that, she has referred 0 kids. So when I did a brain symposium presentation at Punahou School several years ago, I asked if she would come to present on what she did as part of the presentation. So she presented that and was very well received. So, yes, it can help there are specific protocols and specific treatments for ADHD and for the autism spectrum.
Wonderful. One more question. Does it help with migraines?
Yes, it does help with migraines. And of course, it depends on the etiology of the migraines, but it has helped with most migraines. I've had, like now with doing telehealth, I had, for example, just this past week, person said, I can't do my telehealth because I have a migraine. I said, stay in a darkened room and let me talk to you on the telehealth. So we then worked on the migraine, and he said, "Oh my God, I can't believe it. I didn't even take the Imitrex, and my migraine is gone." So then we had the full session and worked on the other things.
Another question. Does it work on vertigo?
It can work on vertigo, depending on the etiology. But actually, when I was first starting to do the demonstration for the behavioral medicine, and we were having a little, skepticism. Of course, this is a strange looking therapy. So that one of the very skeptical doctors was having problem because one of the patients with vertigo was not able to leave the examining room because every time she started to get up, she felt dizzy and like she's going to throw up. So finally, the nurse said, "You know, can you help because this we're backed up now over 1.5 hours because we're only using one exam room because the person is in the other exam room can't get up." So I went in and worked with her, and after I think we were working about 15 minutes or so, and then she said she feels better, she could handle the nausea. And part of there's a whole other treatments too, but under the nose is a major part of the nausea treatment. So she said she doesn't feel that. So I said, okay, can you very slowly get up? So she very slowly sat up and she said, I'm okay, a little scary. So I said, okay, keep doing this. So we kept tapping. I said, oh, don't bend down to get your slippers on. Let me try to help you with that so you don't bend your head down. And so she kept on tapping. She got up, walked out of the examining room, and the doctor's jaw dropped open. He said, "Oh my God, how did you do that?" So I explained. And he said, I was real skeptical, but now I'm a believer. So he started referring people.
Nice. Thank you.
Yeah. Okay. And then what I'd like to do in the age of COVID, let me show you what we can do. There are alternative treatment points that I researched and looked at and have tried out. And I have cleared this also, uh, shared this with Joanne Callahan, who is the widow of Roger Callahan, who developed the thought field therapy. So this is alternative tapping points that are off the face. So this, instead of the bladder meridian, you can actually do the base of your skull on the back of your head. So you can do that on the base of your skull on the back of your head. And you can do it bilateral. A lot of people prefer bilateral, but you can do either side or both. For under the eye, for your stomach, you can do the base of the neck above the collarbone. And for the one that's under the nose, the governing vessel, it is this, it meets here. So it's the same point that we can use for the eyebrow. It's the base of the skull and the back of the head. And for the under the lip, which is the central vessel, you can do it right at the collarbone notch. So right in the middle there, collarbone notch. And for the outside edge of your eye, for that gallbladder, you can do the base of your head by your ears. So those are the ones you can do off the face. So let me also show you, we were looking at, let me try to get the previous screen. Oh, well, let me get to looking at, say, one of the points we're tapping is the tiny finger. So touch your tiny finger, and then without touching it, concentrate your attention there. Wherever your attention goes, the energy flows. So as you focus your attention there, see if you can feel a very subtle, almost imperceptible physical sensation. Takes more time to do it mentally than by just tapping on it. But if you focus your attention, how many feel a little? You feeling that? Yes. Okay. So you feel that little tingling, pulsing sensation. That's how you can do it mentally. Once you know how to do that, you don't, like we have the entertainer who's doing it right on stage in front of hundreds of people for his panic attacks, and he's doing it mentally. He can just do it without just mentally focusing on the points. Doesn't even have to look at it. Just mentally focus on those points. So Once you know how long it takes before you can feel that little tingling or pulsing, if you are doing like an audio recording of your treatment protocol, you would allow extra time. So in case you're doing it, tapping is faster, but if you're doing it mentally, you need a little extra time to focus on the point to really get it. So you would, in your audio recording, allow extra time in between each of the points. So if you're listening to it, you can do it either by tapping or you can do it mentally. So if you're doing it, you wake up in the night with a nightmare, that would be a good thing that you can then mentally do it, and you listen to it through your earbuds. You won't disturb anybody. You don't even have to do the tapping. You can just mentally go through the points, and it can actually bring it down. I just today I was working with someone who said, oh, she's freaking out because her blood pressure is too high. So we said, okay, take your blood pressure now and what's high, and say, okay, we did the tapping for her anxiety and stress, and she calmed down. I say, okay, take your blood pressure again. She took her blood pressure again, 20 points lower on the top figure, and on the bottom figure, she was actually, that was about 10 points lower. So she said, oh my God, how did that happen? I said, well, you can actually do that when you're your changing your sympathetic nervous system, you're lowering the cholesterol, you lower the heart rate, you actually lower the blood pressure. I said, I do that all the time so that they've never put me on high blood pressure medication, because if it's high, I said, oh, can you wait a few minutes and do it again? So I'm busily doing treatment. And then I said, okay, you can do it again. And they said, oh, it's normal now. Okay.
That's amazing. One more question. How about for someone with dementia who grinds their teeth constantly?
Yes, with the grinding the teeth, it depends too on what it is. But if they're grinding the teeth even during their wake state, not just at night. Yes,
Yes.
a lot of times when you have a lot of frustration and anger, and when we have a loss of functioning, like with dementia, it is very aggravating because can't remember things or can't communicate things or can't get people to understand that. So we're constantly tense and angry, and there are things we want to say but it doesn't come out. So there's a whole lot of, it's actually more like rage, anger. And so we have, when we work with the anger, frustration, rage, and uh, some of there's might be other things, guilt and other things, but when we work on that and the tension drops, they tend to have less of that, because if it's related to like frustration, anger, that can remit. So a lot depends on the etiology, but seen a lot of people are remit. So we have some dentists who are referring people that they look at. I think this person, they say, yeah, they're not, and it's hard to tell because with dementia, they're not able to articulate. But a lot of times is that you can see their frustration because they can't do things like they did before. They can't communicate things like they did before, and people don't understand what's wrong. So there's a lot of frustration and anger.
Well, so I got your book. How can other people get your book?
Oh, there's different ways. If you want to get it, we do have copies here, and we can actually make arrangements. But you can also get it from Amazon. It's available through Amazon. You can actually, my website here, there's a link to the Amazon where it's available for those who can do ebook. That's probably the cheapest way. The You can get it either on ebook or on paperback. And then if you want a hard copy, even if you get it's not a hard copy, it's a paperback. If you have a paperback, and later on when the restrictions are opened up and we have, I'd be happy to come to the Kokua Mau when you have a meeting. If there are people who want to have their books autographed, I'd be very happy to do that.
Awesome. Jeanette, did you have anything
Great.
you wanted to add? Yeah.
Yeah. So, Caroline, thank you so much. This is great. And I really, personally, I have benefited from TFT, and I really appreciate this now. So I wanted to check how are you doing things now? Because it's such a hands-on practice that you have. Are you doing telehealth? And then do you also do things for, I'm just thinking, staff of the hospice, like how are you approaching this?
Yes, I'm actually doing pretty much all telehealth. There's a few exceptions for specific reasons, but pretty much doing all telehealth. And we can actually, which is nice because they can see and I can see what they're doing. So yeah, if we didn't have such a large group, we would have had people actually doing it too. So we can see how people are doing and work with clarifying different things. And because when we do individualized treatments, I am when people were coming into the office, I was using the TFT diagnostic with the energy testing. I'm also trained though at the voice technology level, so I can do it from the listening to the voice, and I can actually pick up the meridians. They have to talk. They have to be able to talk because I have to hear their voice, and they're talking about the problem. I can get the meridians, and then we can work with that. So we are doing it on telehealth.
Okay, great. Well, thank you. If anybody else has questions, you could either raise your hand and we could unmute you, or you could type it in the chat. But I think a lot of people have already asked Caroline their questions. Caroline, tell us again the name of your book.
Oh, the name of the book?
Yeah, it's over your shoulder there.
Oh yeah, actually that's bigger. It's Overcoming Adversity. There's a poster behind me. How energy tapping transforms your life's worst experience.
Okay, Overcoming Adversity, Carolyn Sakai. Great. Okay, so Sandy has a question. Have you worked with PPL, fortuitous processing auditory?
PPL, not.
Well, maybe
Sandy, want to share
you
more
can
about that?
Unmute yourself if you want, Sandy. I see her typing away, so.
Oh, okay.
People with auditory processing issues.
Oh, it can vary because it depends on the etiology. Any person, though, with any specific or more generalized disability, cognitive disability, experiences a lot of emotional distress too, a lot of frustration, a lot of anger. They have people yelling at them who don't understand that they're not able to process things the same way. So when we always have to deal with the frustration, anger, the hurt, the other aspects that come into play, because when you have those in play, it makes it very difficult for people to focus and learn. Example would be the Rwandans, who many of them got nowhere and they were not being able to function until they were able to work through the fear, the depression, the trauma. So when we have issues, and when you look at, this is a very competitive, stressful world situation, under ordinary circumstances, it has become even more so in many ways because a lot of people, a lot of kids that are being, um, without the hands-on learning, without the classroom situation where they're trying to do things online, and they're more having even more difficulty than most. It is very, very frustrating. Some kids are just crying because they just can't get it and they're really frustrated, and they're going to fall more and more behind. So when you look at this frustration and you look at how to deal with it, what we have to do is if we can lower the emotional component, get people more calm, get people less fearful, less angry and frustrated, then we can actually start to look at helping them with, like, with being able to focus, being able to stay calm so they can actually focus better, and then they'll be able to grasp things and be able to learn more. So whatever the issue is, I think where we look at, we had the same thing when we were working with addicts. We had many people who you can't directly go to working on the addiction because sometimes they're not ready to give up the addiction, or they don't know how they're possibly going to do that when it's been such a problem for them so severely for so long. So we work with the anxiety, the anger, the traumas, all the things. And we actually had spontaneously in our addictions program, some people say, I don't have the anger anymore. I'm not so stressed out anymore. I'm not mad all the time anymore. I worked through the trauma. And so I don't have a need to numb out anymore, but I still have the craving. Don't you folks have anything for the craving? We kind of try not to smile and say, oh, that's a good question. We actually do. So then we can work on that when they're ready. Because for addictions, when you ask the question, how often do you have to do it? Like the cocaine addict, for addictions, you're going to have to do it a lot, because as often as you have the urge, you're going to be doing the treatment. So if you're not motivated, you're not going to do it. So it's not going to do anything. So when they're motivated, they can do it. And when we have any kind of processing, any learning, this dysfunction that makes it more difficult for them to learn, they're usually blocked and frustrated. There are ways we can try to work around the block, because a lot of times people have this mental block that, oh no, I'm not good at, I can't read, or I can't do math, or I can't do this. And once you have that, they almost like resist trying because they don't want to fail more. So if we can get to working with that, so they can be turn that around to have more hope, to have more feeling of confidence in themselves, that would be then very helpful. I see there are more questions too.
Double
Yeah. So
question.
one question. Oh, sorry, Jim. Is that you?
Double question, yes. What if I'm a Kaiser patient? And also, how's this different from acupuncture?
No needles, because you just be tapping on the meridian points. We actually have, I've actually trained several acupuncturists who said that they've actually found that doing acupuncture sometimes it seems to trigger whatever they're working on, then depression or trauma or something comes up. And so then they actually want to learn how to deal with that. And then they refer the person to get you. It's a good question about Kaiser. I used to work for Kaiser. I was chief psychologist there. The Kaiser has a very good program. They have a number of therapists. We used to do thought field therapy there, but they've, since I've left, had several different chiefs who've changed things a lot. However, you can actually request that you be seen soon, and that you want to work with things and you want to work with thought field therapy, there is a good chance if they're not able to get you a practitioner who does know TFT, because there are very few left now. I think about 33 of the ones I trained have retired or moved on. And so if they're not able to accommodate you within a short period of time that you're requesting, reasonable length of time, if their wait time is too far out, they may refer you to people on their preferred provider list. And I am on their preferred provider list. And you can specifically request you'd like to have thought field therapy, and that you wanted to see Carolyn Sakai. If they're not able to accommodate you, they will try.
Okay.
I've had many people from Kaiser who were referred that way. Thank you.
Good. Well, thanks for explaining that. There was a question of like, why have I not heard about this? Who else is doing this in Hawaii? And, I know that you've done quite a lot of work with a number of groups around the state, and there are other practitioners, right?
Yes, there are other practitioners. We have a whole, we've trained about 200 in the state of Hawaii. Some of them are retired, but some of them are still practicing. And we do have some, before COVID, we were actually training doctors, nurses, and others from Health Plan Hawaii. And we're looking at, they were setting up trainings, and then COVID happened and we had to cancel those trainings. So there are more practitioners still being trained. If we got to figure out how to do this, how you guys are doing the Zoom, and if we can, maybe I'll talk to Marcus about how we can do that, because this is, I thought, it's just going to be a couple months or a few months, but this is stretching out longer and longer. And we have a whole slew of people who are waiting to get the training with the thought field therapy, and we'd like to be able to do that. And so, we may have to go to using a format like you're doing.
I'll volunteer Marcus for you. He of course, Carolyn, will be happy to help you.
Oh, thank you.
There was a question about the book. Does it focus on other pain areas such as sinus pain, back, knee pain?
Actually, it's there are, let's see, I can look it up on, there are 3 chapters on pain. The pain management, all of the chapters have the treatments in these rectangular inserts that have the treatment. And of course, in the back, you have how to actually do it with the appendix and the commonly used algorithms. But it's not specific. If you want to have a specific treatment for a particular pain, you might want to look at, if you have any kind of insurance, all major insurances are covering. I have only difficulty if your primary is Medicare. The only reason being Medicare would now cover, it would cover now, but the Medicare requires electronic billing, which I'm still not doing, and I'm a little too old to learn it. So I am still refusing to do electronic. But if you have HMSA Akamai Advantage, AARP, the Advantage plan, those actually you bill it to the HMSA or the AARP designee, and they bill Medicare. So then they do the electronic part. So then that works. So only if the primary is Medicare and it's not under an Advantage plan, that would be the only one. I think most of the plans, HMSA Quest, all the major plans do cover that. In fact, they refer people sometimes for thought field therapy, particularly.
So the MedQuest plans also cover?
Yes.
Great. Okay. Good. That was one. Then Maggie added needles add stress to some patients who are afraid of needles. It's also done by someone else. Patients sometimes feel powerless and dependent. TFT is empowering. Patients can do it themselves and take control.
Awesome. Thank you, Maggie.
Yes,
That's very
exactly.
true.
And I think we've got all of the questions. I hope, Carolyn, you can see the chat room where people are saying wonderful things and being very thankful that you've taken the time to do this.
Oh, thank you so much. Yeah, I've just started to look at it. Thank you very much. Well, it's been my pleasure. I always enjoy your group, and let me know if there are people who have the book who want it autographed. When we can do meetings, and I can show up at your meetings and join you at your meetings, then I'd be very happy to sign the books.
Well, that's great. I recommend the book. Hope and I really liked it. And, as I said, Carolyn is back by popular demand to Kokua Mau. So, Carolyn, thank you so much for taking time to come today and sharing with us. And I hope that people will visit your site and also think about getting the book. And thank you very much for all you're doing to help people in our community, especially in these very stressful times.
Oh, thank you so much. And thank you all for what you are doing. Appreciate what you're doing. Thank you.